Good morning this morning, everybody. Happy Monday. I hope you guys are having a blessed day today. Good morning, good morning, good morning. I hope you are doing well. Hope you guys survived the weekend. Hope you all had a great day. I've got a couple things I want to hit with you this morning before we start seeing patients this morning. So I'm gonna give everybody a chance to jump on. Hope you guys can hear me well, see me all right. I'm back in St. Louis. Many of you know I was traveling last weekend on business, which was great. Got a lot of great work done. Got a lot of great insights. Got some really interesting stuff from some folks with the CDC and quite a few other doctors that we're working with. So let me know where everybody's watching from. Hey, let's see. We got Annie, good morning. Stephanie, good morning. We got Virginia's in the house. Where's everybody else watching from? Lori's at Michigan. Kathy's from Ohio. Terry's in North Carolina. Penny, good morning this morning. Sarah, good morning. Hope you guys are great. I've got a lot of things I want to cover, but we're going to give everybody a chance to jump on. Monique is in Michigan. Good morning. Dana's in Asheville, North Carolina. You guys got some crazy stuff going on in North Carolina. So do you guys, Monique in Michigan. And then Lisa, everything in South Florida. How's everything going down there? You guys getting affected by the potential second shutdown? Angie, good morning from the UK. I was just talking to a good friend of mine yesterday from Camelot Castle in the UK. Hope you guys are well over there. Hope you guys are real well. All right, so a couple things I want to cover this morning. I'm kind of going to be all over the place, but you know what's going on in the world right now. We talked about this back in March. We knew there was going to be a second wave. How do I say this? Phenomenon, if you will. Second wave. Let's go through what the second wave is. Dr. Sherry Tenpenny and I had a conversation the other day. We're going to speak later this week on it, and I'm going to come to you with her so you get her perspective on what's going on. But let's talk a little bit about just this little thing right here. We're talking about increase in infection. Now, this is going to make a lot of people mad. I know that it does, because this is an emotionally charged topic, right? COVID-19 is emotionally charged because we're not talking about just people having viruses, being sick and dying anymore. We're talking about shutting down our country, shutting down our economy again for a second time. Remember, I said this. It's hard to do something the first time, but once you do it the first time, the second time becomes a piece of cake. So it's going to be very easy for them to shut down the economy, shut down the government, not the government, but shut down your life again. We just had a ruling late last week in Missouri that kids are going back to school in the fall, and they're going to leave it up to the local municipalities to decide on if the children are going to be wearing masks, not wearing masks, what they're going to be doing. So I'm going to be spending a lot of this week meeting with politicians and lawmakers and just really trying to educate them on really what's going on. And you guys, if you saw the video I did on, I think it was Friday or Saturday of last week, it talks about masks. It talks about that there's absolutely not one double-blind, randomized, controlled study that shows the benefits of masks, especially with COVID-19. There's not one. There's not one. And the things that people have been showing me, because I've been playing around on lots of other social media sites and groups and talking to folks and engaging back and forth with people about wearing a mask. And at the end of the day, people send me these things like from the Mayo Clinic. They'll send me an op-ed, which is an opinion article that was written by the Mayo Clinic, that they feel it's a good idea to wear a mask. Or at Stanford, some science at Stanford says they feel like it's a good idea to wear a mask. But there's no randomized controlled studies that show that masks help reduce the spread of COVID-19 or any COVID. Okay, I mean, that's just important to understand that. There aren't any. And I've asked many people to send me them. And anytime someone sends me a study, what's sad is that people aren't reading them. They're literally not reading the papers. All you have to do is go down. If you want to read the whole thing, do it. But at least go down to the discussion and read in the discussion or the conclusion of what it says. And if it says may help, may prevent, that does not mean it does. It's not statistically proven that it can, and that's what a scientific paper does. It's not an opinion. A scientific paper is supposed to bring a hypothesis to truth. It either does or doesn't. So now check this out. With wearing a mask. So I'm going to be talking with some legislators tomorrow and pretty much the rest of the week up until Thursday because this is 4th of July weekend and people just want to get off the grid. So why are we freaking out so much about an increase in detection and not an increase in infection? Let's talk a little bit about the tests that are out there. Now, many of you know that I had some mixed feelings about testing or straight out of the gate, okay? Now, I want to read you something right off of the CDC, the Center of Disease and Control Prevention website. It says testing for infection of COVID-19. This is right off their website. I literally just pulled it this morning. This was updated June 25th, so it was updated, 4 days ago, right? 4 days ago it was updated. And it says this: if you have a positive COVID-19 test, a positive test result shows you might have antibodies from an infection with the virus that causes COVID-19. However, there is still a chance that positive test results mean that you have had antibodies from an infection or a virus, the same type virus in the COVID family, coronaviruses, such as the one that causes the common cold. It says it right here. It says it right here. So there's a lot of false positives that are happening. I'll tell you that you guys know we work with several labs all across the country, and I had a gentleman in my office last week talking about their laboratories, and we talked about how, they would test their staff regularly because their staff surround samples, and they just want to make sure there's no cross-contamination. So they would test their office manager. One day they would show up positive, one day they would show up negative. Another day positive, another day negative. So there's no consistency to the validation of these tests. And so there's a lot of false positives. There may be a lot of false negatives as well. We don't know. We just know that, remember, none of these tests have been approved by the FDA. We got to make sure that we're clear on that. None of these tests have been approved by the FDA. So we're still trying to figure out, are these tests valid or not? It's pretty crazy if you think about it. So just because there's an increase in infection doesn't mean there's an increase in death rate. So let's talk about that. We're testing more people now than we ever have. Would you agree with that? Would anybody disagree that we're now testing more than we've ever tested? We absolutely are. So if we're testing more, if we're looking for more, don't you think we're going to find more? I mean, if we tested everyone on the planet for heart disease, don't you think we'd find more heart disease? If we tested everyone for cancer, don't you think we'd find more cancer? I mean, if you look at this is a really nice article. It's just a really nice visual that talks about the different types of things that we die from in our country every day. Every day. I posted this off of or on our social media just a little bit ago. It says things that we die from every day. We got 48,000 people die from heart disease every day. We got 26,000 die from cancer every day. We got 10,000 die from respiratory disease every day. We got lower respiratory, 7,000. We got dementia, almost 7,000. Digestive diseases, almost 7,000. We come down here and we see 26 people die from natural disasters every day. 200 people die from poisoning every day. 330 die from fire. 809 die from drowning every day. I mean, there's a lot of things that we die from. Way less than COVID-19. We're not shutting our world down for any of this stuff. Now, I know people are saying, well, those things don't spread like COVID-19 does. We really aren't quite sure exactly how COVID-19 moves around. We just had a scientist just the other day we were talking to about how there's two ways of potential spread of this, right? We know droplets are a potential spread. If I sneeze or spit on you and it gets in your mouth, there's a chance for infection with that. But then there's a chance of maybe potential aerosolization, right? Being in the air. And we talked about how, remember, during the winter months, because the air is less humid, right? It's less humid, that those droplets, those aerosolized particles can live in the environment and air a lot longer than whenever it's humid. That's why we see such a drop in infection rate after we get done with the winter time, right? Because why? Because when there's increased humidity, those droplets drop down and we don't get an infection as much. I mean, that's just what all there is to it. So a couple other things that I want to say is I had a conversation. I was reading some of the work that Dr. Zach Bush was doing, and I just want to talk about this. So what do you think? I want to know, what do you think? Do you think we should wear a mask? Yes or no? And if so, why? And by the way, I've done all the research, looked at all the double-blind controlled placebo studies, looked at the peer-reviewed studies. There's not one study, true study, that shows that masks prevent COVID-19, or really any virus for that matter. And I'm talking about peer-reviewed. I'm talking about, double-blinded. I'm talking about true studies. So when I talk to folks about, why we wear a mask or why shouldn't we, at the end of the day, what people say is, well, I want to protect my grandma. What if I didn't wear a mask and I got someone sick? If I wear a mask and I save one person's life, isn't that worth it? I mean, these are the conversations that I'm having with people. And so at the end of the day, here's what I'm saying. Here's all I'm saying. If you want to wear a mask, go ahead. If you want to wear a mask, go ahead. I have no problem with that. I'm not going to mask shame you. If you want to do it, I think that's your decision. I don't think it is. It is absolutely is your decision. I know it's your decision. But if I don't want to or someone else doesn't want to wear one, don't mask shame them. Now, listen, as a business owner, I can totally understand that if you don't want to have a patron come in that does or does not wear a mask, that's your right. You can absolutely refuse business to anyone as long as you are a privately owned, non-subsidized business. I know that for a fact. Airlines, which by the way, they just got a big bailout, so are they subsidized? Kind of think they are. If you really think about it, most businesses right now are subsidized because of all the extra injections of cash that we've got and all this kind of stuff. So just think about that for a minute. But if you don't want to wear one, don't wear one. If you want to wear one, wear one. There's no research that shows that it helps. At the end of the day, this is an emotionally driven thing, not a scientifically factual driven thing. And I've asked people before to show me the research that shows that there's anything that can prevent, that shows a mask can prevent stuff. There isn't. People say all the time, I wear a mask because if I'm right, then at least I save one life. Well, let me just tell you something, guys and gals. My religion, so I'm a Christian. You know, that's just my personal religious beliefs, and I kind of feel the same way about being a Christian. You know, if I'm right, then I lived a good, righteous life, and all is good, and I go to heaven. But boy, if you're wrong, that's a scary thing. I get it. But it's not the same thing, right? I'm not shaming you for not being a Christian. I'm not allowing you to get on an airplane because you don't believe the same way I believe, or I'm not allowing you not to see my friends and family because of that. Like, this is crazy. It's literally gone out of control. And how about wearing a mask or mandating masks 3.5 to 4 months after an outbreak happens? You guys, eventually we're all going to have to get exposed to this so that our bodies can develop an immune response to it. That's just how this works. I don't understand any other way. And if wearing a mask slows down the spread or keeps you from getting infected, that's just going to prolong this thing until the fall. Like, we just need to get this over with now and be done with it so that we can develop immune responses. And then people say, oh, that's so irresponsible. People are going to die. 100,000 people have died. 126,000 people have died as of last week. Well, let's look at that for a minute. Can we look at that? 126,000 deaths, by the way, for just a minute. There's an investigation happening right now. Now, this is on the Hill. This was actually just reported on last week. It says House committee tasked to oversee the country's response to coronavirus pandemic in nursing homes. If you look at the deaths that were attributed to nursing homes, it says right here, this is really sad, by the way. And I'm not saying nursing home workers killed people. I'm saying laws and restrictions and regulations killed people. Look at this. It says right here, during the briefing, CMS, this is Medicare numbers, allowed almost 30,000 nursing home residents and nearly 500 staff have fallen dead to COVID-19. But experts suggest that the number is closer to 60,000. So they're saying now the 126,000 deaths that are out there, they're saying that potentially 60,000 of them are dead because of exposure in nursing homes. Well, that's half of them right there. That's 50%. So would we be freaking out? Would we be freaking out? Would we be freaking out if there were 60,000 deaths from COVID-19? I don't think so. I don't think so. Why? Because if we go back to the numbers here and we look at the deal. Where did I put it? At the desks that are out here. I got too many papers on my desk. Look at all the things that people die from every day. 60,000 people is what we're saying. I mean, hell, almost 50,000 die a day from heart disease. You know, we're not banning McDonald's. We're not banning junk food. We're not banning sugar. You know, cancer. Almost 27,000 people die a day from cancer. We're not banning, certain medications. We're not banning cigarettes. We're not banning things that are known carcinogens that are in our foods and in vaccines, are we? I'm just really confused by this. You know, almost 4,000 people die a day from diabetes. Almost 3,400 people die a day from car accidents. 3,400 people die a day from car accidents. We're not banning cars. Yeah, I just don't get it. I'm really confused by all this, and I really, truly want to understand. Because to me, it seems pretty common sense, but I don't know. I don't know what's going on. People say they wear a mask out of respect for others. That's the narrative that's out there, but there's no proof. Well, listen, if you want to wear a mask because you feel like it's right, do it. If you feel like it respects other people, do it. But if you don't. I wear a mask because I don't wear a mask because I feel like it respects others. I feel like if I were to wear a mask where there's no evidence of it, then that's going to poo-poo the fact of everything else that we stand for, that we stand for in healthcare. It just makes no sense. And by the way, the whole idea that the hospitals are being overrun, you guys, this is absolutely asinine. These are again, it's the media lying to you. It's the media confusing you. It's the media propagating this to get ratings up, to sell stuff to you. I mean, that's all this is. For example, the hospital that's in Texas, the Memorial Hospital Systems there that's quote unquote at 100% capacity. Listen, here's the deal. The hospitalist, the guy who runs the hospital, came out and said the hospital normally runs at 85 to 90% capacity. It was at the same capacity at this time last year as it was this year. But nobody's reading that. And there's only about 20% of people that are in that hospital that are with COVID-related illnesses, whereas the 78 to 80% of those people are non-COVID related. That's in the article that Newsweek put out, but yet that's not the headline, so most people don't read that. I'm just really, really, really confused by all this. I just don't get it. I don't understand it. I'm really confused. I'm really concerned. I'm trying to understand. I'm trying to get other people to understand. If we want to defund something, we should defund the media. I think if we stopped watching television for 30 to 60 days, we'd be over all this crap. Wouldn't you agree? I mean, there's an increase. Look, there's an increase in detection, not an increase in infection. Look at this. This is the death rate, you guys. Look what's happening. Okay, look. I mean, this is March. Okay, this is June 20th. Look, it's here. You guys, it's gone down big time. And I don't understand the shutting down of everything again. I don't understand the concerns. I just don't understand it. It makes no sense. It makes no sense. I just don't understand it whatsoever. A couple things that Zach Bush was talking about, that Dr. Bush, I just want to make sure that you understand this, that, there are 10 to the 31 power. Let me say that again. 10 to the 31 power in our body viruses. 10 to the 31 power. So we live with viruses all the time. If we have a healthy microbiome, like if we have a healthy GI tract, we take a good healthy probiotic every day, we're getting our vitamin D, our vitamin C, we're eating right, we're hydrating, we're exercising, we keep our weight under control, then there's no problems. Common sense is just not that common anymore. It's just not. We don't really fight against these viruses. They actually help strengthen our immune system over time. They get into our DNA, and our DNA adapts and it evolves. And it has that way for as long as mankind's been on this planet. That's true. That's absolutely true. And I've got some concerns as well, you guys. I want to talk about this if I can find it. The FDA just came out and had a warning June 22nd, just a couple days ago. You probably didn't hear about it. FDA warns against 9 hand sanitizers because they cause potentially fatal ingredients. They contain potentially fatal ingredients. Most of the hand sanitizers that are out there that have endocrine disruptors in them, that's a problem. I mean, look, right here is the title right here. FDA warns against using 9 different types of hand sanitizers because they may contain potentially fatal ingredients. That's a big deal. So there's no research that's showing that hand sani reduces COVID-19 spread. It does kill your bacteria in your gut. There's no research that shows that social distancing truly works, none whatsoever. And the 6-foot number is an arbitrary number that was just pulled out of a hat that Fauci, Birx, and whoever just decided was the right idea. Remember when SARS was around and a couple of years ago, early 2000s, they said 3 feet or more. But they all the research said during SARS and MERS that only healthcare workers need to wear a mask. And that thing was really deadly, not like this. I mean, the FDA comes out and says, not the FDA, but the CDC comes out and says, talking about the antibody testing that's done. They said the CDC just released this. What they said was that the antibody testing, the study projects over 25 to 30 million Americans. 25 to 30 million Americans have already had coronavirus, which drives the death rate down to well below 0.2 to 0.5%, which means we have a 99.5 to 99.7% survival rate. I'm just so confused by all this. I just don't understand it. It's all political. It just makes absolutely no sense. If we get our microbes right, some of the things that are problems, which I'm going to talk a lot more later. Listen, one of the reasons why, let me show you this. The death rates in some of these states, like if you look at these, and whatever they are, it's just the truth. It's democratically run states. So the highest death rates, New York, California, New Jersey, okay? New York, California, New Jersey, and Illinois. New York had 30,000, almost 40,000 deaths in New York. And they're saying the majority of those, half those, if not more than half of those, are from nursing homes. California had 5,600. Jersey has almost 13,000. So remember, New York and Jersey are very sick states, right? They're very sick states. There's more pollution there. There's higher dense population. Where there's pollution, Zach Bush and a lot of other scientists will talk about higher pollution is going to equal higher viral load. That's why, when they talk about eradication of polio, which was a virus. Well, polio is not eradicated. If you look in countries like India, where there's high pollution, polio still runs rampant there. It has a lot to do with our external and internal environment. If you look at Pennsylvania, Michigan, they're 6,500 and 6,100 respectively. I mean, it's pretty amazing if you look at the death rates. I know that it's a mirror image, but it's just insanity. And if you look at this, I know this doesn't make a whole lot of sense to you, but this is the last 10 years. I'm sorry, this is actually 10. This is the last 20 years of what's called all-cause death. So all-cause death, how many deaths that happen in a year? We're still on point for all-cause death, which means this. The same amount of people that died last year, the same amount of people that are going to die this year. The only time that we see any major spikes in all-cause deaths are if there's, like a war, a famine, if there's like a volcano that erupts, something of that nature. We don't have any of that stuff. So what do we need? We need more people less sick. Let's talk about this for just a minute. A couple hot points, and then I got to get going. We got patients we got to see today. Most viruses are a reaction to your sick environment. Look at the areas that are hit the worst. Large metropolitan areas, high pollution, dense populations. They're sick people. They're sicker people. They're more stressed out. They're sicker. People who have had weak immune systems, weak microbes. So people who have bad gut bacteria, bad microbial function because they're not eating real foods, because we're eating too much GMO and too much glyphosate. That kills our good, healthy bacteria, which is what's necessary. It's in our microbiome, part of our immune system to keep us healthy. We got to eat more healthier microbes. Physicians and scientists have really created this problem. I mean, that's the truth. Physicians and scientists have really created this problem. That's really, truly the case. And they're controlling. That's the thing. Like, we're treating symptoms. We're totally treating symptoms. We need to treat the cause of the problem, not the symptoms. Who cares about the symptoms? Right now there's a list, and the list keeps getting larger and larger and larger when it comes to COVID-19. They're saying everything from, diarrhea to respiratory stuff to muscle aches and pains. All a symptom is your check engine light in your body saying there's a problem, right? I mean, that's not the cause. The cause is what's really going on. The cause is bad microbiology, bad health, obesity, poor vitamins, poor nutrient content, too much stress. And then when we get stressed out, listen to this. This is what's happening. This is why we can't make rational decisions about anything that's happening right now. Because when we get stressed out, right, what happens is part of our brain called the frontal lobe turns down. Our body goes into fight or flight response. When we go into fight or flight response, we can't rest, we can't digest, we can't grow, we can't develop, we can't heal. There's a lot of research. Look at the study that just came out of China. I mean, this study is like 2 weeks old now, and they're showing that the majority of people who perished from COVID-19 had not only vitamin deficiencies, but they had a really bad microbiome in their gut. Their microbiology of their GI tract was really, really bad. So they weren't eating good, healthy foods. They didn't have enough good probiotics. They were sick people from the inside out, so they couldn't fight off stuff. The virus doesn't kill people. It's the downstream infections that kill people. The bronchitis, the pneumonia, the respiratory issues, all this other stuff. That's what kills you. That's what kills you. So common sense is just not that common anymore, and that's unfortunate. It's a very unfortunate thing. But you guys, we're doing things in politics and in life right now just to do things. Like, if one governor says we should wear masks, everyone else says we should wear it, because nobody wants to take the fall. Nobody wants to be accountable. Nobody wants to be responsible for potential problems. But that's not true, though. We're playing politics. We're not really truly diving into healthcare. And the people who got us into this position, the scientists and the doctors, cannot be the people to get us out of it. We're really going to listen to the modelers that were wrong from the beginning, that said 2.2 million Americans were going to die. They were way off with that. And social distancing did not cause that to die off like that. That's not the truth. So, here's another thing that people really piss me off with. People say, well, are you a virologist? No, I'm just a guy that has common sense. Yeah, I'm a doctor. You know what? I'm a DC. You know what that means? Doctor of common sense. Are your doctors talking about this? No. But you know what I do have? I have an understanding and an ability to read research and literature, and I'm not a lazy POS. I'm studying this stuff nonstop because most people are too damn lazy to just go around and look up stuff because they're just getting their information from what the internet tells them or what they read on MSN or CNNBC or whatever. Or it's all crap. Stop being concerned about the BS and start looking at the facts. The facts are, this is a 99.5 to 99.7% survival rate. The facts is that the death rate has gone down drastically. Is that the infection rate is going up because we are testing more people. And by the way, the tests are flawed. And by the way, the tests are not FDA approved. Let me say that again. The tests are not FDA approved, which means they haven't been vetted, they haven't been tested, they have not shown to be conclusive. What are we doing? Does it really make any sense to go through all this stuff? No. So what we need to do is this. We need more people less sick. You need to focus on the solution and not the symptoms. You need to get your body healthier. Get your body to a healthy weight. Make sure you're hydrating every day. Drinking half your body weight in ounces of water every day. Make sure you're getting vitamin D levels up. That's a big one. Remember, the average adult, you got to consult your physician, but the average adult uses 10,000 IUs a day of D3. Vitamin C every day, dose to bowel tolerance. You should be on a good gut bacteria, a good microbiome rebuilder. You should eat root foods, vegetables, lots of dark green vegetables, fermented foods. These are things that we should be doing. We should be exercising to reduce our stress. We should be doing some breathing exercises. We should be going and seeing the chiropractor regularly. Why? Because when you get adjusted from the chiropractor, it makes your nerves work better. If nerves work better, your organs work better. If your organs work better, the organism works better. And that's how we get healthier. The people who got us into this problem cannot be the people who are going to get us out of this problem. It's really very simple. But you can continue to follow those folks if you like. Continue to follow the blind leading the blind. Continue to follow more anxiety, more stress, more problems. I don't know what to tell you. There's a lot of fake news out there. It's not hard to read through it, but you got to do a little bit of work. The research is already done for you. You just got to pull it out and take a look at it. But again, most people are too lazy, won't do it, and they just don't care. They just want to perpetuate the problem. So I love and appreciate you guys. I got to go. I got virtual consultation starting in just a minute, okay? Yes, there's a lot of fake news. Yes, there's a lot of BS out there. Go back and watch that video I did, or go below. There's a link we can share. Go to wellnesswarrior.club. Click on that link. There's all the research about masks are on there. Any of you guys that are watching right now, go and check out that research on those masks and watch that video that I did and share that with your friends and family. Did a video on that the other day that went pretty crazy. So all good stuff. I love and appreciate you guys. Hope you have a blessed day. Happy Monday. Let's make it a great week. God bless you and God bless America. Bye, everybody.